Thank you, Lucia. And I want to send out a big thanks to Emily and Carla, who worked tirelessly to make today possible. We're all virtual, of course, but that doesn't mean there isn't a tremendous amount of work to make events like this happen. I want to make sure that they get the recognition they deserve. Thank you also to Bob, who I haven't seen in far too long, but his support and drive to make this event a cornerstone at Mount Sinai is a wonderful, wonderful thing. So I want to start my remarks, which will be brief, with a couple of observations. Irretrievable financial balance sheets that have come from providing care to the patients we serve have forced closures of U.S. healthcare facilities. Hospitals and clinics, especially those who serve poor and rural Americans, shuttered at a pace to rival those of Macy's department stores. While expenses for sick care in the United States reached $3.4 trillion, 1 in 5 of all dollars spent in the country, life expectancy in the United States has been ticking downward, owing mostly to the obesity epidemic and opiate epidemic. Insurance companies reported record profits, and a reported 2 in 5 healthcare workers reported exhaustion, that their empathy wells had run dry, or other symptoms of burnout. And all of that was true in January of 2019. I don't have to tell any of you what has happened in the last 10 months and how COVID-19 has added to this mix. We've all lived it up close and personal. When not serving our patients, we've been largely kept in our homes, where we're left with few outlets to get away from the tribulations of 2020. One of these might be to watch TV, but even there we know we cannot escape anguishing images, such as those of our fellow citizens who, in a misbegotten rage, raided the halls of Congress and the foundations of democracy. To salt the wound, many of our elected officials have blithely condoned or even encouraged this assault on our country. And here we are today to talk about climate change and how we can better serve our patients. How dare we? How can we have the audacity to do this? We do so because we have no choice. The climate crisis, the COVID crisis, the equity crisis, they're 3 strands of the same rope. Woven together, they can hang us, or they can provide a lifeline to us. 2020 will likely be declared the hottest year on record, tying 2016. No one here needs a recounting of the evidence showing how we are hurtling towards an unlivable planet because we're burning fossil fuels and chopping down forests. Yesterday, COVID-19 cost the lives of more than 4,000 Americans, a daily total that is 4 times as great the rate of heart disease, the nation's leading and traditional leading cause of death, having caused about 655,000 deaths in America last year. Climate change and COVID are not equal opportunity killers. Black Americans are probably 2 times or more as likely to die from COVID-19 as whites, and Black Americans are much more likely to breathe polluted air. A recent paper from colleagues at the Harvard Chan School found that even as air pollution nationally has improved dramatically in recent years, disparities between people of color and whites and between poor Americans and richer Americans have grown. People of color and the poor are getting left behind. We know that where there is poverty, there is pollution. We know that air pollution is a principal cause of death worldwide. We know that air pollution contributes to the incidence and severity of pneumonia. And we now know that air pollution, or we have strong evidence that air pollution, especially long-term exposure to air pollution, increases the chances that people will die from SARS-CoV-2 infection. And so we are left to wonder, is the outsized death toll among Black Americans that we have observed, at least in part a consequence of the festering and long tail of their historical enslavement and subjugation? The air pollution that we all breathe in this country largely comes from burning fossil fuels, but for some of us, that air pollution is coming more and more often from fires in our forests. That case is even more so true for people who live closer to the equator in the tropics, where the smoke that people breathe routinely comes from burning forests, usually to clear them. The ongoing loss of forests in the tropics is a problem that's hard to fathom, not just because it's far away, but because of its scale. It would be reasonable to describe what's going on as forest genocide. About 2.3 million square kilometers of forest were cleared last year. That's roughly 4 times the state of Texas in area, mostly for the purposes of cattle grazing and growing palm oil that goes into everything from cookies to cosmetics. The fires result in vast releases of carbon dioxide that warm the planet, along with air pollution that exact vast harm. But don't let the distance between these fires and their harms fool you. Their relevance to each of us is abundantly clear, sadly, thanks to COVID. These fires destroy the homes of many creatures, including those that may be most likely to harbor pathogens like coronaviruses and Ebola, which makes forest loss half a world away a major concern for everyone around the world. So we have 3 strands in our crisis forged rope: climate, COVID, and equity. And I propose that we use this rope to show us a way forward. We can use it to underscore that climate actions can prevent pandemics. We can stop climate change through prevention of forest loss, and we can forestall pandemics through preventing forest loss. And when we address the root causes of climate change and pandemics, we in fact are taking anti-racist actions because the consequences of unbridled climate change and loss of forests disproportionately affect people of color and people who are vulnerable in our societies. The actions we need to address climate change are the very ones we would prescribe, if we could, to address the major health problems we face in our practices. We can burn less fossil fuel, eat more plant-based diets, walk and bike more, and sit in cars less, and spend more time in nature. And with each of these, we can get at the largest disease burdens: heart disease, obesity, cancer, mental health disorders among them, that we face, and in many instances, are relatively ill-equipped to fix within the confines of our hospitals and offices. But why us? Why are we the ones to take on this amid all else? Because we see in our clinics how racial injustice and poverty create the fault lines, the faults that crises like climate change and COVID exploit. We know the value of science, and just as importantly, we know its limits. We have trusted relationships with the people we care for. And we know when it comes to climate change that when healthcare providers speak about climate and health, it can transcend the political morass that engulfs the issue and makes climate change personal, actionable, and hopeful. We have yet to fully grasp how important our actions as healthcare providers are to providing a healthier, more just, and sustainable world. We cannot afford to suffer from a poverty of our collective imagination or our collective will as we approach our work. With every patient we see, every medication we administer, and procedure we perform, we can and will heal. To protect ourselves, our most vulnerable neighbors, our families, and especially our children and their future, we must depoliticize climate change. We must make it personal, we must make it actionable, and we must grow the ranks of those in healthcare who speak about health and climate. And that is why today is so important. Thanks.